Good morning, everyone. Happy New Year. Hope this finds everyone well. Welcome to the first edition of Saturday Morning with Coffee and Medicare. I'm your host, Steve Osell. I'm also the founder and owner of the Osell Agency, where I created the Osell Agency for a very simple purpose, and that is to enrich the life of seniors. So let's go ahead and get into today's video. Hopefully you've come across this video because you're either turning 65 or maybe you've worked past age 65 and now you need help understanding your Medicare options. So let's get right into it. I'm going to share my screen and I'm going to show you a website, which if you haven't seen any of my previous videos, I would highly recommend you take a look at. And if you need help finding this website, I will give you my phone number and my website address at the end of this so I can help you find this website. But I do really encourage everyone to take a look at this website if you get a chance. So this is your Medicare red, white, and blue card. And the website, by the way, is medicare.gov, medicare.gov. So the first page I'm going to show you here is just a picture from medicare.gov of something called your Medicare health insurance card. Now, if you're over age 65 and you're getting Social Security benefits or have been getting Social Security benefits since you turned 65, likely you probably already have this card. And this card is going to have a few pieces of information. It's going to have your name. It's going to have your Medicare number, which is unique to you. And it's going to have something called your hospital Part A and your effective date of the coverage. You're in your medical Part B and also your effective date of coverage. So again, let's use the example this morning in our video of you're 67 years old, you've worked a couple of years past age 65, and good for you. Now you've decided you're going to get that place in Sun City, Arizona, and you're going to retire, you're going to buy an RV, or maybe you're just going to stay home, and that's fine. Whatever you decide, good for you. Congratulations on your retirement. But there's a few things you need to know about your Medicare coverage if you've worked past the age of 65. I'm just going to give you general information. There's always exceptions to these rules, but generally what most people will do if they've worked past age 65 and they have their Medicare card is they will have their Part A already. And so for most people, again, most people, the Part A doesn't cost you anything. You can read my writing very well. There's no premium for Part A. And the reason there is because if you've worked at least 10 years or 40 quarters, you've already paid or prepaid your Part A premiums. So again, for most people, you're not going to have a premium for that. Part B is not free. There is a premium for Part B, and you will have to pay a monthly premium for most people for Part B. So most often, what most people will do, what most of my clients will do, is they will send their Medicare card back upon turning age 65, and they'll say, I don't want Part B. I want to opt out of Part B because I don't want to pay that premium. And for most people, that makes sense. Not every time. I recommend that you call the Social Security Administration and get that advice from them and or your HR, your human resources professional at your employer. But in most cases, most people are going to opt out of that Part B. So in most cases, if you're 67 years old and now you're going to retire, your Medicare card is only going to have Part A. It's not going to have Part B. But now you've decided to retire. You're going to leave that employer plan, and now you need to get your Part B because you need your Part B if you want to have medical insurance. And if you also want to purchase a Medicare supplement or Medicare Advantage plan, you need to have that Part B in place. So what do you do now? Well, first of all, let's just take a quick look at what the Part B costs. So remember when I said that Part A is for most people no cost, but Part B is not free. So let's look at what, again, in 2021, the costs for your Part B insurance are for most people. So in 2021, and again, this is income based, the vast majority of people, if you fall in this line, of income, and this is based on your modified adjusted gross income from 2 years ago, falls between these amounts, so it depends on if you file individually. If your modified adjusted gross income from 2 years ago is less than 88,000, you will pay this amount monthly for your Part B premium, $148.50. I'm not going to read off all these columns. Again, this information is available to you at medicare.gov, and I can help you find this information or send it to you. But if you're a higher income earner, you would actually pay more for your Part B. Now, the vast majority of people pay this $148.50 per month, and that amount, that premium, typically goes up each year, every January 1st, based on federal guidelines, federal rules. So let's go back to our Medicare card, and let's look at another example. So let's say you turned 65 a couple of years ago, and your Part A, again, your Part A, let's say, started on 3/1 of 2016. Now, 2 years later, you retire, and you've called Social Security Administration. You say, I want that Part B to start now, and it's 2 years later. So your Part B effective date might say, and again, forgive me for my writing, 3/1 of, maybe it's 2 years later, 18. So these dates are going to be different. So let's say you're going to retire March 1st of 2018. This is what your card will now look like, and they will send you a new card. Now you will start to pay that Part B premium to coordinate with your leaving your employer coverage. And then at that point, if you wish, many people elect to also purchase a Medicare supplement plan, a Medicare Advantage plan, and or a Part D prescription drug plan. So I hope you found this information helpful today. Again, my name is Steve Osell, and I am the owner and the founder of the Osell Agency. And if you would like more information on Medicare, I hope to see you back with another video, or you can visit my website at osellagency.com, or you can give me a call at any time, and you can see my phone number on the screen. My number is 612-804-1101. I've helped thousands of Medicare beneficiaries navigate through their Medicare options, and I would be more than happy to help you. And our mission, once again, at the Osell Agency, is to enrich the life of seniors. So thanks for watching my first video, Saturday Morning Coffee and Medicare. I hope to see you next week on another video. Take care and have a great day, and Happy New Year. Bye-bye.